So much for joining. And Samima, could you introduce yourself, please?
Yes, hi, I'm Samima Amani, the Director of Operations from Ampla Health.
Thanks so much for joining us. Appreciate it.
Thank you.
Lily, I'm going to put you on the spot because I know that you are new to California Health and Wellness. Lily Clemens, can you introduce yourself, please?
Yes. Hi, everybody. Good afternoon. My name's Lily. I'm the new program manager working for California Health and Wellness alongside Mark, and just really excited to join this group and work on e-consults statewide.
Thanks so much, Lily.
Thank you.
Do we have other clinic representatives on that would like to take a moment and introduce themselves? And we know some of you may be in a practice setting where it's hard to talk. You're also welcome to use the chat if you haven't had a chance to introduce yourself as part of our group. Please do feel free to chat questions, comments throughout our call today. We really appreciate your time. Okay. With that, moving on, just a little review. I think most of you are familiar with how eConsult works, but if you are brand new to the process or you're just trying to figure out how it's going to work within your clinic setting, we like to talk to primary care providers and their teams to see if they might think of considering eConsult as the first step to a non-urgent or routine or non-procedural referral requests. So primary care providers and their teams can decide the best process for their patients, whether it is request for an in-person visit or an e-consult, but this is a good first step, especially for those specialties we know are scarce. We know that PCPs are important to maintaining that relationship. We want to think about that patient's medical home, and it's really up to the provider team to determine the best next step. What we're seeing, which is so wonderful through ConfirmEd, primary care providers that use ConfirmEd see around, I believe, over 75% of the questions that are asked by primary care providers have been resolved without the need for a face-to-face visit in our cases. So it's great to see such a great success rate in preventing those patients from having to travel to an unnecessary visit. Just a little bit about our coalition. If you're new to our calls, we are open to anyone who wants to join. This is free for anyone to participate across the North Rural counties. We support Medi-Cal managed care patients and uninsured patients to get e-consults. We hold our monthly roundtables. We have CME opportunities that we'll talk a little bit about, continuing medical education for providers. Over the past few months, we've worked to support advanced reimbursement or advancing reimbursement under Medi-Cal. We had a state bill that made it all the way through, unfortunately was vetoed at the very last minute, but we're going to continue working to toward primary care reimbursement for e-consults. If you are in a provider setting, you might know e-consult is reimbursable by specialists right now and not by primary care NFQs. So we'll talk a little bit about that ongoing and how we'll continue to support e-consult reimbursement. You as providers, I think many people on this call today have been really standing up eConsult and being champions for it across your clinics and across the state. We appreciate Anthem and California Health and Wellness really spearheading this effort, making it a collaborative effort between plans, making it less of a challenge for providers, knowing that they can do this for all their Medi-Cal managed care patients and for their uninsured patients. We are looking to be able to provide a dashboard, so reports to show how this is impacting the North Rural region, counties across the North, and improving access to specialties across the North State. And this program model is expanding. So we started out doing this in Central Valley. We rolled out to North Rural, and there are other counties across the state are really interested in seeing what we're doing together. And so we're really a model for other counties. I'm just going to take a pause here. I'm not sure if anyone at Anthem or California Health and Wellness wants to pipe in here. I've said a lot, but welcome your input. And I welcome your questions all via chat too. So please feel free to pipe in at any point. I'm going to take a moment here. We like to stop on a monthly basis and think about and look at how eConsult's being rolled out. We know so many of you are new to this. We'd like to take just a moment and hear from those who've been doing this for a while. So every month we're going to spotlight a clinic that has stood up eConsult and is doing it actively in their clinics. And through our managed care plans, through Anthem and California Health and Wellness, want to provide an opportunity for a little bit of an incentive for the staff. We know this takes time from primary care providers and referral teams to be able to support this. So the plans are supporting providing a lunch to those provider groups who are active in eConsult. So with that, I'm going to introduce Aaron Brinko from Wellspace. Aaron's going to talk a little bit about his experience to date. So thanks for joining us today, Aaron.
Thanks, Libby. So yeah, I just kind of to give a brief overview of eConsults and how they've, my experience with them and Wellspaces as well. I think, in general, when you bring something new to the table, there's always a little bit of grumbling and grinding to get it off the ground. People may not be initially comfortable with the idea of eConsults, and maybe rightfully so. It's not something maybe that has been a workflow for many providers in their training. So understandable that folks are uncomfortable. In my experience, though, once they start to begin using eConsults, it really makes a big difference. And I think, Libby talked about some of the real benefits, not just to providers, but to the patients. It eliminates, the amount of time that they have to take off of work to travel. For the population, certainly the Wellspace serves that can be a really significant barrier to accessing care. So if they're able to do that via eConsult, they can get that needed care without having to take additional time off. I think there are some challenges certainly with eConsults, especially when it comes to the state's policy. Libby touched on that. FQs aren't eligible for to bill as a primary care provider for eConsults, so that certainly is challenging. I think that maybe sometimes our plan partners could help fill gaps there by providing reimbursement for it, and that doesn't just mean plan partners. I include kind of our IPAs in that as well. So I think that as with many things Medi-Cal related, many of the challenges that we have in the Medi-Cal population, so much of it sometimes ties back to reimbursement. Happy to answer any questions that folks might have, or Libby, if you have any additional questions.
Yeah, that's really great, Aaron. I really appreciate your candid feedback here. The reimbursement challenge that we've been facing over the past few years is really top of mind for us, and really pushing forward, readdressing or reintroducing State Bill 365, which we were disappointed to see have vetoed, but we're going to be working with our state senators to reintroduce that in the coming year, and hope that they are going to support this, as we know it's such a great priority. And you really hit the nail on the head, also noting our group, our coalition is not just for clinics, it's engaging our IPAs. So Navano and River City are involved in our group too. If there are other providers that we have not looped in that we should be engaging in our group, thank you for letting us know. That would be great. Any questions for Aaron? Great. Well, thank you, Aaron. If you have additional questions or comments, please feel free to use the chat, and you guys feel free to converse as we're going through our other materials. Thanks for your time today, Aaron.
Thank you, Libby.
Okay, we have some other examples of use of eConsult that we're going to share today. So moving on, just wanted to note, and I know our ConfirmEd team is on today, who will talk a little bit about this too. We announced this last month, but we wanted to remind everyone that we're excited that eConsult is now available not just to Medi-Cal managed care patients, but also to those without insurance. So uninsured patients and Medi-Cal managed care patients in your counties across your clinic sites can now have access to eConsult. So your primary care providers no longer have to wonder, oh, can I do this for an uninsured patient? Yes, you can. I'm going to stop for a minute I don't know, Karina, if you'd like to elaborate on this, you're welcome to say a few words. And after we do that, I'm going to have Marianne McGuire from ConfirmEd talk a little bit about the process. Karina, anything you want to add?
Hi, everyone. This is Karina Mendoza with Anthem Blue Cross. Can you hear me? Okay.
Yes.
Okay, perfect. Yeah, I just wanted to just encourage our provider groups to utilize this coverage that we put out there for the uninsured population. So for if you're submitting e-consults now and a part of the coalition, then you can now have this coverage for the uninsured population. So if there's a patient, that presents and they're uninsured, Anthem is provided a $50,000 sponsorship in collaboration with CVHN to offer this. And I'd just like to say thank you to CVHN and ConfirmEd for all the work that we put in getting this set up. So I just would like to voice to definitely utilize this now that it's open and active. So thank you.
Thanks, Karina. And before I put our ConfirmEd team on, just wanted to note that Central Valley Health Network is an organization that a number of clinics are participating in. Those who are up north may not be part of CVHN. We encourage your networks, if you have groups that you engage in as part of your work across the North State, we encourage those to join our coalition also. So Marianne McGuire, with that, I'm not sure if the ConfirmEd team wants to do a quick highlight of how this works. So how does a primary care provider get an e-consult for an uninsured patient? Do you want to talk about that briefly?
Sure. Thanks, Libby. Hi, everyone. This is Marianne McGuire. I'm the Director of Strategy at ConfirmEd and have been involved in the coalition since the start and really excited about the Anthem grant around the uninsured patients in both Central Valley and the North. And what we have been doing from our team side at ConfirmEd is our client leads, Michelle Chapman and her team, have been reaching out to each of the practices within Central Valley and the North Rural areas to just let them know you now have the ability to submit e-consults on your uninsured patients. And they've walked through, Michelle and her team have walked through with the referral team, particularly at the practices, the very minor things that they need to pay attention to in doing this. And that's really just stating it's an uninsured patient and use the Anthem grant. Pretty straightforward, very clear, no big lift here. And that's basically it. I'd say to date, the questions that our client team has been getting from you all, from the practices, from your referral team, from the operations leads at the practices is mostly, who is an uninsured patient? So what we want to state is, and this is from the Anthem grant side of this and from Blue Path, uninsured are your patients that have no insurance at all. So it's not for the fee-for-service Medicaid patients or Medi-Cal for California. It's not for those on the exchange that have a really high deductible plan and basically have to pay that before they can get any coverage. It's for the true patients that have no insurance. So I think that's pretty clear. And once we say that to the practices and to the referral teams at the practices, it's been clear. But we're going to go out again with another reminder to everyone next week, just to remind you all that you now have this ability to use e-consults for the uninsured. We've seen a few e-consults come in so far for the uninsured out of the Central Valley only. So really great reminder, and this is a great place to push that reminder. So I'm just going to ask if anyone has any questions about the uninsured program in North Rural area. You can use the chat, I guess, Libby. That's how you like to do it.
Oh, anyone is welcome to unmute themselves if they want to ask a
Okay.
question. I just know people are sometimes hesitant to speak out, so you're welcome to take a moment and unmute yourself if you wish.
Yep. So I'm reading something in the chat. What is the reimbursement rate for a visit that falls under the parameters of the grant. So I'm assuming, Aaron, you're talking about I want to be sure, the uninsured. It basically, we are charging the grant the same amount we would charge our payers, which would be the plans in those locations. And we pay our specialists as well. Same rate for uninsured as if it was a Medi-Cal patient. So the practice pays nothing. So I think that's the important piece here. And the practice, it's not set up for the practice to charge anything for submitting an e-consult for the uninsured. And he's got it, so we're good.
Okay, and you just brought up a really good point that we just want to make sure that all clinics are aware that the FQs, RHCs, Indian Health Centers, whoever is on the call, clinics do not pay for e-consults. So the payer and the grant is covering the e-consult fees. So this is free to clinics.
Okay. So, I think it's a pretty straightforward approach. It's just another source for complete payment of the e-consult where the practice pays nothing and they can get the access for the uninsured through this grant. So, and once again, the grant is from Anthem Blue Cross. And we'll just continue to use the grant until we spend the money. And if we can, obviously like most grants, as everyone knows, if we can build the case, it's always positive for trying to find future funding as well.
Thank you, Marianne. So please do ask any questions that you have around access, whether it be uninsured or others. Please share those in the chat. And Marianne, I think you're going to speak a little bit about best practices. So I'm going to go to the next slide.
Yes, thank you, Libby.
We have heard from you all in the North State, also from Central Valley providers, that there's a few specialties for which it's especially hard to get access. As a response to this, what we try to do is to focus on having the ConfirmEd team or providers who've done these consults share examples of what they look like and what kind of responses are helpful to providers. So before Marianne shares, I just want to note, if there are specialties that are of great interest, those that you cannot get your patients scheduled for, share those with us, because those can be our future topics of our future focus areas for our calls and for our continuing medical education. So Marianne, I'll let you speak around rheumatology.
Sounds good. Thanks, Libby. I think this was a really great choice for a topic, particularly coming out of the North Rural area and Central Valley as well. From the ConfirmEd side, we have done about 2,000 rheumatology e-consults since 2017, and the majority have been in California. And it speaks to the need, it speaks to the access issue for rheumatology. And in rheumatology, we think about what are primary care providers, what are we seeing in those 2,000 e-consults? What's the theme that's coming through here? The theme from the practices from the primary care providers that are asking for e-consults in room really have a lot to do with lab interpretations, particularly around a positive antibody test. In their lab look at when they have patients that come in and present with, the multiple joint issues, bilateral or unilateral, things that kind of resonate to them in their differential diagnosis. Am I looking at what type of rheumatological condition? So we see this, and where can the e-consult help here? It's a quick response back to the PCP to say, okay, I see your notes. I see your issue. I see your labs. This is what it looks like. It looks like you need to do this next series of lab studies to get at a low ANA rate. And what does that mean in terms of making a tighter differential diagnosis? Or just as importantly, to reassure the PCP that the likelihood of a rheumatologic disease is really low in this presentation. So remember, for everybody on the call, our specialists see your medical notes, see your labs, see your radiological reports in here. So that helps them comb through and give this guidance. And this can happen, right? In, less than 48 hours, they can get to this. And if it is that they need to do more labs, they do more labs and they submit the e-consult again. And if it's in the same range of days, let's say, there's not even an additional e-consult charge on that. It's just part of the same e-consult, which is really important. But this is a really high driver of the questions we get around interpreting the positive antibody tests and helping guide the primary care on how to do more of what they need to do next before considering referring out. The next thing that we're seeing frequency of is the diagnosis of rheumatoid arthritis, lupus, and psoriatic arthritis, right? 3 very common presentations. And it's helping get to them to, is their diagnosis correct based on presentation labs? And then beginning the direction of how to initiate the disease-modifying anti-rheumatic drugs that are available that primary care can use and monitor. Or if they've already started on one of the first levels of those drugs, how to adjust, maybe how to move up one more level. What can they do in the interim before they need to ultimately go to face-to-face down the road in there? And we do a lot of this in the e-consults, is working around the DMARDs with the primary care providers and what's a recommended initiation, how to initiate the drug, and what to be monitoring in your labs and how frequently you want to see the patient in there. And last, really common, and I don't know if we have any primary care providers on the line today, but fibromyalgia is a big one. And what really comes out in the specialist's e-consult is that really combing the medical record to kind of rule out anything else that this might be before landing just on this diagnosis. So these are the 3 main leading areas of primary care consults for rheumatology. And what I have up for you to look at is an example of one of our e-consults that came in from one of the practices. And actually, this is one from California. And what the primary care is asking here is the primary care is saying, I have this patient, a lot of, multiple joints are getting worse with weather changes. Really important concept in rheumatology, and what you want to share with the specialist is what makes the discomfort and the pain worse and what makes it better. That does help them frequently in making the e-consult more focused and helpful to the primary care. In the primary care tells them, the patient notes that, she has pain when she does this with this hand, stiffness in these fingers when she does this, goes into what the physical exam showed, some deformity in the pip joints, some tenderness and palpitation there. She ordered the x-rays. What did they show? Kind of gave a synopsis of what the labs were and saying, hey, and this is the last point I really want to emphasize. The primary care saying, I really want to, I want to refer this patient out, but she's on state insurance, obviously meaning Medi-Cal. So it'll take a long time. And this is the basis of what we see in California is waits are really long for rheumatology. So our rheumatologists who do the e-consults, they know that, and they know to give really detailed guidance back to primary care to implement so that they can keep the patient in primary care until maybe they can get a face-to-face down the road if that's needed. So what this e-consultant did was they walked through really nicely, like, what did I see in your labs and in your notes? And this is what I would think you should be doing. She said, the specialist says, yeah, this likely is rheumatoid arthritis. And it looks like the patient doesn't have any existing liver diseases and doesn't consume alcohol regularly. So this is the first line drug. So when we think about the disease modifying agents in rheumatology, first line drug would be methotrexate. And you can't, you don't want liver disease and you don't want a regular drink, you're taking methotrexate. So that's the guidance there. The primary care sees that. You can start it at this dose, this many tablets, really giving guidance. You need to take folic acid along with it. and after screening for Hep B and C, right? And if you get a common GI side effect, you want to increase the folic acid. So great guidance on methotrexate. And this kind of dosing and approach is not this patient specific. This is kind of general how you would begin first line treatment. So now the primary care provider has this detailed knowledge to use the next time. Talks about what to be monitoring in your labs until they can get to a rheumatologist. And for short-term relief gives the general prednisone taper to give the patient some benefit. If the primary care gives an alternative to methotrexate, if the primary care isn't comfortable with methotrexate, starting to use that, identifies that it's in a suboptimal choice to methotrexate, but here it is. Recommends a baseline eye exam for ocular toxicity with this. So this is a great example of exactly what happens in rheumatology. And this could be, you could put lupus in here, you could put so many other diagnoses in rheumatology, but the level of detail that needs to come in to really guide the primary care, to monitor, to treat, to care for the patient in primary care. And maybe it doesn't need a rheumatology visit eventually, but if it does, this is everything you can be doing until they can get in. And just to speak to that, rheumatology in general, recommendations on our 2,000 e-consults to date, 80% of those remain in PCP management. Libby, you want to just go to the next slide? And here's, when speaking with our rheumatologists that answer the e-consults, what helps them give really great advice back to the primary care provider? It's things like in the notes, it doesn't have to be in the referral clinical question. The one you just saw on the prior slide was really quite an exceptional clinical question that was done really well, very detailed. Sometimes they're not as detailed, but in the medical note, there is details. And in rheumatology, the things that really help the rheumatologists get to this is like, joint pain, what's the duration, the onset, the location, all standard things in a symptom and review. Associated symptoms, you saw this, morning stiffness, et cetera, fevers, fatigue, help in the diagnosis, what aggravates, what helps it. Is there any relevant history? Is there psoriasis with this patient? Do they have IBD? All these things in autoimmune worlds that matter in terms of helping focus the diagnosis. Of course, the labs and the radiology reports. This is like what makes a rheumatology consult stronger when these things are present in the medical record. So in terms of rheumatology, we continue to grow our adult network. Currently, we don't have pediatric room yet in California. We are heavily recruiting for that. It's just is one of the ones that's very hard nationwide to get. And we also Health Net sponsored our ConfirmMed Echoes. And I think everyone on this call, since you are practices of ours that work with us, have been invited to ConfirmMed Echo. And we've been doing it for a few years. Health Net has supported that. We have done 2 rounds of rheumatology already in that for the primary care providers. And we actually just finished this July. We did 4 sessions in rheumatology as well. Those are in our library with the practices. If anyone in your practice wants to have access to listen because they were unable to attend live, that's available. So please reach out, let us know, we'll get you the information. So why don't we kind of take questions if anyone has any questions or suggestions around how to make rheumatology better.
Thanks, Marianne. Any questions from the group? We welcome questions coming in through the chat too. And Mark Schweier, who's on today, from California Health and Wellness and Health Net. Mark, do you have any comments on this? Anything in terms of your observations around echoes or anything that you want to say in response here?
Yeah, thanks, Libby. So we're very interested in extending the ability to, for provider network to engage in Project Echo. We think it's a good opportunity for professional development. So if you're interested, like Marianne had said, just please reach out to us. So thanks, Libby.
Thank you, Mark. Okay, and thanks again, Marianne. Really helpful
welcome.
examples. It's great to see some best practices and really just how this works in the detail. Another program we want to be able to remind folks of, in case you're new to our North Rural eConsult Coalition, is access to the CAP program, Child and Adolescent Psych Portal, which is eConsult. I'm sorry, at this point it's a telephonic consult for child psych access. We're looking to be able to provide eConsults too at this point, but we wanted to highlight that access to the phone consult program, which works just like this. Where a provider enters their request, sends it over to the UCSF psych provider, same as an eConsult. However, this gives the opportunity for your local provider, for your FQ or rural health center provider, to talk to a UCSF specialist around that child psych case by phone. So what we wanted to do is just give a moment to remind folks that this is accessible or open to our providers across the North State. So if you look in your chat, if it's hard to get the link from the slide here, you can always get it off of our chat. Providers do need to enroll in this program in order to access it, and it's met some great response to date. So we hope that you'll take a moment, share this with your peers. I know many of you may not be the primary care providers, but you're representing your organization. So if you could make sure that your providers know that they have access to this program. And on that note, we tried to listen to providers' needs. We know that there is, coming out of COVID, coming out of the wildfires that you've all been impacted by, there are needs for mental health, behavioral health support, not just for children, but for all patients. We heard this loud and clear through our presentation that we had from CHAP a Day a couple of weeks ago, that was really just talking about loss, how people are so impacted. And I'm preaching to the choir here. I don't live in a state that is or a county that's been impacted by wildfire, but we know people are hurting. This is a time where people need this type of mental health. So we're looking to offer this continuing medical education session in January for how eConsult can be done for behavioral mental health. So this link you can see here on the slide, and in addition, we'll put it in the chat so that if any of your providers or staff, and this is available to anyone who wants to join, it's a free session on eConsult for behavioral mental health. And thank you so much, Kira, for putting that in the chat. These slides are also in your email if you want to share with others on these programs that are offered to help providers out. We know we're still in a time of crisis, and we're looking to see what kind of resources might be helpful. And with that, we are looking to plan for 2022. So I'm just going to pause here and note that we are all tired of Zoom. I know you're tired of Zoom. You take time out to listen to these presentations. We're not as interactive as we'd like to be. We'd like to be sitting with you in a room across a table having a conversation, and that's not the same on Zoom. We don't get as much input as we'd like because we're all on video. So if you can take a minute, grab this link that Kira is going to put into the chat, and it's in your slides and email once again. This is an opportunity for you or for your providers or staff, your referral teams, if they are the ones who are really digging deep into the eConsult. We want to hear from you. So you have a greater team that's on the call today. So hand this link to them if that's the person who should respond to this survey, not you. I'm going to do, meaning this will come from me, I'm doing a drawing for a $25 electronic gift card from the respondents of this survey. So if you want to take a minute and copy down the link, it's a very simple survey. I just ask who your organization is, who's the responder of the survey. We want to know how active your clinic is, or how active you've been in doing eConsult, what you need, what are your biggest priorities around eConsult? Is it education? Is it focused on payment incentives policy? We know that we're not, you see patients that are outside of Medicare and uninsured. We know you see commercial and Medicare patients too, and that's of interest to you all. We are driving policy, as we mentioned before. We are capturing data from our ConfirmEd reporting and from our payers to be able to show how eConsult's impacting our counties. You might want to hear more about technology. Marianne and her team can talk more about use of technology and how this can be incorporated into your team's workflows, and also how this can be part of the referral team's process. So we want to know which topics are of most interest to you. And as I'm talking here, I'm just talking for a couple more minutes, but you can even do the survey while I'm talking. So it's so simple. We'd love to know just the top 5 in terms of your specialty access needs. This will help us to determine what CME opportunities we might have in the future. We want to reach out, do more outreach across the North State, get CBOs, others involved, policy leaders across the North State engaged in our conversation. Figure out what kind of workflow support, what handholding you might need at the clinic site. Other referral partners, we have, obviously we have both primary care providers and hospitals on our call today. We want to hear who's most important in terms of communicating across your counties. Which referral partners can we invite to our calls? And I think that's the end. Oh yes, just if there are any other topics you want us to be speaking on. We had UC Davis on our last call talking about best practices that they use to engage both primary care providers and specialists, and just want to know what topics are going to be of interest to your group. So I welcome your comments. If you want to unmute, if you want to share via chat. I'm going to put Ampla on the spot. I know Ampla, if you're in a place you can't talk, I totally understand, but I know Cindy, Samima, you've been doing this for a while. Just any thoughts on what might be helpful for your clinic, for Ampla in the coming year, anything that you want to see us focus on?
Now, one thing that I feel like I've really identified is staff. We're so busy, of course, with COVID, having more telemedicine encounters as a result of that. I really need someone who can actually just focus on e-consultations. If we had that, I think that our numbers could increase. And I'd love to hear from everybody else what their strategies have been. We love e-consultations, and sometimes our providers forget that it's available. And so I really need, I feel, someone who could really focus on, being out in the field in all the clinics and reminding the providers that this is available. So really, I'd like to write a grant to hire someone to do this. I do have a telemedicine coordinator, but of course, that position has gotten pretty big. So really, I'm feeling like I need another person. But as far as the e-consultations go, wow, they've just been amazing and really, literally lifesavers for our patients.
Thank you, Cindy. And I think it was probably 6 years ago that I met you. So I know you've been doing this for a while, or at least you've been really active in leading telehealth. So thanks so much for your leadership here. And, as we come out of COVID, it would be great to meet you all in person. I have met some of you in person, but not all. And so our team, although I can't help you with my doing e-consults myself, Cindy, I would love to be able to spread the word and create tools to be able to do that, and also see you in person. So thanks so much. Any other comments in terms of needs for 2022? Anyone would like to share? Thank you, Cindy, for being willing to be put on the spot there. Appreciate it.
My pleasure.
So just once again, please share this. You have the monthly meeting information that you're welcome to encourage others who are in your community to join. I think you're all, those who are on the call today are familiar with this, and you know the benefits to e-consult, but we also know coming out of COVID, your staff limitations, your staff are still strapped. As Cindy mentioned, people have a lot on their plates. So if there is a way that we can help you to determine how e-consult can reduce that workload, we'd be happy to do that. And just a last few comments in terms of resources. Speaking of time, Cindy and others, I'm sure that many of you weren't able to sit on our annual meeting. It was a long webinar. It was 5 hours with a lot of content packed in there, but you are welcome to copy this link here. Pick and choose which sessions might be of interest to you. We were so happy to have Chapa Day featured, talking about, as I mentioned, the challenges coming out of COVID and wildfires and how e-consult has helped them. So that presentation is right at the beginning of our video. And if you move to the middle of the video, you can hear a little bit more about where eConsult policy is going with presentations from Anthem, or with panelists from Anthem and HealthNet, California Health and Wellness represented, talking around what we can do to really move policy forward. So if you want to grab this link here, you can scroll to the point in the video that has these presentations. You can tell by the slides what we're talking about. And we wanted to point out, we also have additional resources that come out on a monthly basis through our eConsult news. You probably have that in your inbox from this morning. In this, you can see the presentation we just mentioned. So the recording of our eConsult work group along with the slides. If you just want to take a look at the slides, quickly click through what was presented, you can do that. Our survey link is in your inbox too, the one that we just went through, and a mention of our drawing. And we also like to share examples of recent publications. So we like to look for things that are more pertinent to you, many of you being in rural settings. It was great to see this piece come out of Geisinger, which I know is back east, but it's about eConsult in rural settings, looking at neurology. So great examples of what was found in rural northern and in the rural northeast. And last, you can see our rural eConsult website is linked here, so you can find past presentations if you want to take a look at those. Our website is right up in the upper right corner. And this is the econsultworkgroup.com website, the one that we maintain with just publications from across the country, best practices from groups that have been doing this for a while now. If you are interested in learning more, we meet on a monthly basis as part of a CHTF funded effort, and you'll see all those links in your newsletters too. I know you're probably having meeting overload, but just here are additional resources when you have the moment to take a look. And last, we'll get this on your calendar so that you have the December 15th eConsult work group meeting. We'll meet again as our roundtable in December. That meeting request will come out soon. And I'll just take a moment. Any final words that you'd like to share, Mark? Anything you want to mention before we wrap up today?
Yeah, Libby, thanks. So again, we've been engaged in the eConsult journey for a number of years, over 6 years now. And it's something that we really have invested heavily in terms of effort and time and resources, because we really believe in it. We believe that it, especially during the COVID crisis now, has just amplified the need to have resources out there in the rural landscape. So your organization hasn't implemented, and you're working towards that or interested in any way, please reach out to us. We're in lockstep with our what used to be our competitor, it still is, but in cooperation with Anthem, we saw the value in providing one unique, unified service, for providers. So it's easy, it's easily implemented. We've got national leaders in the ConfirmMed program that can help implement very rapidly with minimal work on your side. So if you haven't started that, please reach out to us, and we're happy to meet with you and collaborate and get a program up and running for you. Thanks
so much, Mark. Yeah, and I can connect any new providers to the right resources to get started. You see my email here. And appreciate your point, Mark. Really important to note that Anthem, California Health and Wellness, HealthNet have worked together on this. This is a really unique program. Karina, any last words before we wrap up today? Okay, I think we might have lost Karina. I just wanted to appreciate your time today. Thanks so much. Oh, go ahead, Karina.
I'm here. Sorry, getting off mute. No, I just want to say thank you to everyone who joined the call today. Definitely just want to echo utilizing the Uninsured grant that's out there. So utilize that. And yeah, if there's any questions on getting started or support, we're also here to provide that. So thank you so much.
Thanks, Karina, and thanks everyone for your time today. This recording will be available if you want to share the examples, especially around rheumatology. If those are of interest, you can share this recording of our webinar. It'll be available on the North Rural eConsult Coalition website. Thanks for your time today. Bye-bye.